Okay. We will start off with our guest speakers, Francisco and Carolina. I will let them introduce themselves a little bit more once they start presenting. Thank you again for joining, and we will get started shortly. Francisco and Carolina, is all yours.
Thank you very much, and gracias a todos por acompañarnos today. We are so excited. Please don't send us any tomatoes or onions. I know that maybe you are tired about Medicaid expansion, but we have perfectly a lot of information that we want to show you and we want to talk to you. Maybe some information that you will see here today with Carolina and I, you already know it, but maybe there are a couple of slices that are going to be very helpful for you. And today as well, I have my colleague from the Department of Health, Carolina Siliceo. My name is Francisco Guzman. I'm the Minority Outreach Coordinator at the Division of Child and Family Wellbeing. Carolina.
Thank you, Francisco. So as Francisco just shared, we're happy to be connecting with you all. We have a few updates we'd like to share. As you know, as of December 1st, Medicaid expansion has been live for folks who are between the ages of 19 and 64, and also the income eligibility has also been expanded. And so we're going to talk to you all this morning a little bit about that. I apologize if my throat is a little raspy. I'm getting over a weekend cold. I don't know what to call it, but Carolina and Francisco, and I'm happy to be with you all this morning.
And Carolina, I would like to mention that our colleague and friend Jasmine Rico is here in the call. Jasmine is going to be supporting us in case if somebody is doing an extra comment, and Jasmine, feel free to join us in the conversation. And as we know, we have a lot of things to talk, and if you don't mind, you can write your question and we can see your questions at the end.
Thank you. So as I was just sharing, Medicaid expansion, as you all might know, started on December 1st, and through this income expansion and age expansion, we are able to provide coverage. NC Medicaid is health coverage, just like any other health coverage, and it's here to support North Carolinians and their health needs. So a quick recap of this: we're providing more healthcare coverage. Folks who may be eligible now and may not be aware, and so a lot of our work is helping inform and helping educate our community members who may be eligible. Anyone can and should apply. We really want to stress this. No one should be discouraged from applying. Expansion eligibility criteria includes living in North Carolina, being between the ages of 19 through 64, and being a citizen, although many non-US citizens will also be eligible to obtain health coverage through NC Medicaid. Coverage is here to help with primary care, hospital services, maternity and postpartum care, prescription drug benefits, behavioral health, preventative and wellness services, dental and oral health services, medical related devices, and other therapies. And you can find more information at medicaid.nc.gov that better outlines all of those distinctive services that will be eligible through NC Medicaid.
Thank you, Carolina. And then we don't want to go very deeply with your math this morning. Maybe you haven't had any breakfast today and a lot of numbers are going to be tricky for you. But this is one of the important slides that we have today, because it's our income guidelines that we have to follow for Medicaid expansion and other group of population. For Medicaid expansion between 19 and 64 is 138% of the federal poverty level. But Francisco, what is that federal poverty level? Okay, basically is the income that we have every year. And as you can see in this side, we have, if you are a single adult or family 3, 4, 5, 6, depends, it depending how much you are earning per year, it depends if you're gonna be eligible to qualify for Medicaid. Now, if you can see the chart at your right, you have another groups that are joining as well Medicaid. They have a different federal poverty level. For example, talking about children, you have a 211%, pregnant woman 196%, older adults, people with blindness, people with disabilities, also apply for 100%. Now, this is very important for us to provide to our communities. Even you have flyers and paper online, but we don't want to see people dismotivated at the time for going to the DSS office, because if I'm a family of two and I'm earning $27,300, maybe for those couple of dollars that I see as a difference, I don't want to go to waste my time. Every single person has a different situation. Maybe 6 months ago, my income was different than the income that is right now. That's why our suggestion is try to go to the office, try to figure out, nobody's going to charge you for an application. And the most important thing is that maybe if you are in that gap back and forth in your income that you have in the last months, maybe you're going to be eligible for Medicaid expansion. As the same way, if you are a father or a mother that you are applying for your children, don't hesitate to go to get an application and to see about the guidelines that we have for the incomes. Remember, we don't have to have a social security number as a father or as a mother to apply for Medicaid for children and youth. You as a father or as a mother, you are able to assist in an application. It doesn't matter if you have a social security number. In the case of Medicaid expansion, when we have a little bit more of specifically categories, can we go next, Carolina, please? This list is a huge list of immigration categories that we have to have for Medicaid expansion. Now, you see here, it could be a green card holder, asylees, refugees, Cuban, Haitians, and a huge list, including human trafficking recipients. Just I want to tell you something. If you consider that you have your community in a status that is not clear for you, I recommend to you try to go to the Department of Social Services to visualize if your category is going to be allowed to get Medicaid expansion. I want to just clarify that, for example, when you have a certain status, it doesn't matter which status is, depends the category that you have. Maybe you have to wait 5 years to get the services of Medicaid expansion. It doesn't mean like if I have a list of these categories, or if I'm allowed to get one of these categories, I'm gonna have already Medicaid expansion. Depends what is your category, is depending about if you're gonna be with access of Medicaid expansion. And of course, those who doesn't have, that we will see later, those who doesn't have a social security number, or they don't have any legal status, they may qualify for other temporary coverage services. It's called emergency Medicaid, but we will define in another slices what is emergency Medicaid. Maybe in your county, there are people who are arriving as refugees, and they don't know that they must go to the Department of Social Service to try to apply to Medicaid, or it could be person with a T visa that is in the process. That's why I'm encouraging you to push your community to see with the Department of Social Services what about. Next, please, Carolina. When we're talking about cost, as you can imagine, Medicaid is a combination between federal and state, and you don't have to pay monthly premiums with a marketplace that regularly you pay monthly premiums for a private insurance. But Medicaid will pay the cost for healthcare services, and the highest copayment is going to be just $4. And it's only required for some services. Which services, until you have the service in place, you're going to realize what is going to be your payment. Now, as Carolina mentioned in the beginning, course, with Medicaid expansion, you will have a huge number of activities talking about health that you may just pay the highest copayment of $4. Next. Okay. There is no way to say that you cannot apply to Medicaid expansion. We have now these forms that are going to be able for everybody. I'm going to start with E-Pass. If you have an E-Pass, it could be one of the best way to do it because E-Pass is electronically. Of course, if you are planning to do E-Pass, you must be with a computer, with a telephone, with Wi-Fi, and be patient to fill it out some digital forms. Now, E-Pass is going to allow you to apply very easily. You don't have to go to the office. Everything is electronic. Of course, they will ask you for an email address. I'm going to do a parenthesis regarding E-Pass. Before, E-Pass was not allowed for parents without a social security number. I'm talking about like 5-6 months ago. But now, for example, in the case of children and youth, if parents want to apply through E-Pass, they can do it. It doesn't matter if they don't have a social security number. The only thing that they have to have NCID and they have to have email address. It is important to mention, like, somebody can help you to do the E-Pass account. You don't have to do it by your own. Somebody can help you. Just make sure, because there are sensitive information that you have to provide, make sure that you trust in that person. Now, the other way is the healthcare.gov. As you can imagine, it is wonderful the help that the Department of Social Services is doing, but now we have these navigators that can help us to apply through E-Pass and to try to figure out if you guys are eligible. That means that you have more options to do the application of Medicaid expansion. We have another way that is paper application. Some of you still like the paper application. Personally, I don't like that at all, because if you have any mistake, maybe the application is going to be back and forth, but you can still use it with no problem. Just make sure 3 or 4 times that the paper application is strictly very well filled, and make sure, of course, that your address is correct. Now, I can tell you that if you change address, it doesn't matter. Just talk to your Department of Social Service to inform them that you have changed your address, because it's going to be clue that if you need a paper application and you move from another address, then could be tricky to get you in another address. People have lost some of the process because they recently changed the application, the address, and they never informed DSS. The other option is in person at your local DSS office. Being in person at the local DSS office is a really good experience. Sometimes you have smiley faces, sometimes maybe you don't. But if you see something, say something, don't worry about that. But the advantage to go to the office is you have a person in front of you talking to you. And if you don't speak English, Spanish, or other language, you have an interpretation line. It's a must of any DSS office to have interpretation service. In case you found out any DSS office that they are avoiding the interpretation service, let us know, because we have to talk to them about this situation. Our children are not going to be the interpreters. That's why we have services paid for the interpretation service. And the other one, and it's not the last one option, but I can consider the last one option, because if you don't have patient, the calling to a DSS office is not the best option. Sometimes it could take 30, 45 an hour to get an agent, but you still can do the DSS at the DSS office by call, the process of Medicaid expansion as well. Now, if you can't, you have 1, 2, 3, 4, 5 ways to do the Medicaid expansion as well. 5 ways to do Medicaid for children, for pregnant, for people with disabilities.
And another thing we want to make sure we emphasize, as Francisco just shared, there's going to be a lot of different points of interaction, especially in the process of submitting your application, whether it's ePass, whether you do a paper application, whether you go to your local DSS office. So there will be different points of contact, maybe a letter in the mail, to make sure your case is up to date. Expect to receive text messages, emails, phone calls, and letters so that their contact information is up to date. But what will not happen, and this is, a cautionary word of, you don't expect that at any point in time, money will be requested, a PIN number, or any personal identification of that sort to proceed with that process. And it's important to know, I know that often, there can be distrust with the different ways that people will be expecting this communication, but just to be wary and alert that will be the, we won't be requesting any money there's no cost to fill out the application for Medicaid. So we talked about Medicaid expansion updates. As of February 1st, applications can also be submitted directly through healthcare.gov. North Carolina is now using this federally facilitated marketplace to determine eligibility. Eligible applicants are directly enrolled into NC Medicaid. CMS will be sending letters to encourage the approximately 534,000 people in North Carolina who are eligible for Medicaid to update their information on healthcare.gov. Some of these folks might already be enrolled, and they'll be receiving these notifications regardless. This is what we were talking about, a variety of different methods. People will be receiving information and updates about where, about their case and about their eligibility. And I'm getting ready to share with you all also the Medicaid expansion dashboard, which tells us as of February 1st that more than 30,000 Latinos have enrolled in Medicaid expansion, which means approximately about 60% of the Hispanic and Latino individuals that we were expected to benefit from expansion have enrolled. This is great news. We know that these are also estimates, so we're still really encouraging your outreach and your support to make sure that as many people who can qualify for Medicaid and are eligible do take advantage of this health coverage. So here it shows what the NC Medicaid expansion enrollment is by ethnicity and also by enrollment by sex. As you can see here, we are noting that there may be a lower enrollment by the male population and the female population. And some of our bilingual communication toolkits and social media, our PSAs, we're working hard to tailor that to the different needs we're seeing. We did learn that about 9% of our visits to our website, to the NCDHHS Medicaid website, are coming through our Spanish portal. We're also aware that similar to this presentation, it's held in English. We want to make sure that folks who maybe would access this information in English will, maybe for their parents, maybe because they're more comfortable in that language, are also receiving all the pertinent information, especially when it comes to immigrant eligibility and mixed status households. So I wanted to share, if you haven't seen this, we do have a bilingual communications toolkit. It includes a day one flyer covering overall eligibility. Some of you all may have ordered like printed copies of these. You should have already received them if you had a chance to order them from us. Also, like we include social media graphics if you want to take advantage of those. They're available in English and Spanish. Our Medicaid Essentials PowerPoint deck, which can also be used for community presentations, frequently asked questions, and including new material more specifically tailored discussing emergency Medicaid and immigrant eligibility, which is this green form you'll see here with different URLs and places on their website specifically catering to those specific needs and questions and frequently asked questions. So again, this is an invitation. Here is like a quick screenshot of what that page looks like, some of the questions that we are addressing, especially addressing also public charge. We know that with SNAP and a lot of our other benefits, there, in the ongoing years, there has been maybe a hesitance to apply or hesitance to use our services. This discusses and addresses hopefully some of those concerns on using Medicaid as your health coverage. And I just want to take a pause. I wanted to make sure. Okay, Francisco, here, you're still here. I thought you might have been having connectivity issues. Go ahead.
Thank you, Carolina. And it's very important, the previous slides that Carolina showed about the Q&A that you can find in English and Spanish, other languages. Please make sure that you have a time, at least 30 minutes of your time, that you can read each question. You will figure out a lot of information that maybe you cannot imagine, and the answer is over there, and it's easily to figure out. In future slices, we will see some specific Q&A that we have received requests from other previous meetings, and the majority of the questions that people are asking over there. For Medicaid expansion and the eligibility, you will need to provide some information. Caro, can we go at the next? Yes. And we were talking about the categories, and now it's time to talk about emergency Medicaid. This topic of emergency Medicaid, it's been a nightmare in our communities because you cannot sometimes define when is an emergency and when I'm going to be able to use Medicaid, emergency Medicaid, I'm sorry. Everyone is potentially eligible for emergency Medicaid. At least they don't have any social security number, they don't have any legal status. Of course, they have to provide ID, address, utility bill, and that is going to be some criteria eligibility for the emergency Medicaid. Simply what we can see for an example of emergency Medicaid, when it's an accident and somebody has to take you at the ER, or women who give birth and they don't have insurance, that's a specific examples of emergency Medicaid, but it could be other reasons. Just remember that if we step by the emergency Medicaid, is because it's really an emergency that our life is between life and death. Each hospital is taking care of our emergency Medicaid, and of course, North Carolina has a state emergency medical review contractor who determines if the incident is a medical emergency and determines the dates of the Medicaid could cover, because you can imagine that emergency Medicaid will not cover the entire month of 3 or 4 months. They will cover specific dates. It's very important that our community is, if they're going to arrive to the emergency room, before they leave in the hospital, they already talk with a social worker or somebody else. They can figure out the applications. Next.
So can I chime in quickly?
Yes, please, Jasmine.
Sorry, I just wanted to add, I think one of the most frequent questions that we get as well on emergency Medicaid is how to apply. And just wanted to highlight the application is the same as the Medicaid application. So when you apply for Medicaid, you will be evaluated for all Medicaid sort of programs, benefits, and then they will sort of figure out what you are eligible for. For emergency Medicaid, people have up to 3 months from the emergency to be able to apply. So if something happened last month or 2 months ago, they can still apply to see if they can get approved for coverage for that incident that took place, and to see if that's, sorry, I'm getting something on the computer, to see if you qualify for emergency Medicaid. And I just wanted to highlight that the immigrant eligibility did not change with expansion. So the immigrant eligibility information that you are seeing is the same as for Medicaid in general. Just echoing Francisco's comment on making sure that you take a look at that immigrant eligibility two-pager from us. We also link to the Justice Center, which has a lot of, similar information. It's formatted in a different way, more of a table. And for the 5-year wait that Francisco mentioned, for some immigrants that have that qualified immigrant category, there are exceptions. So pregnant people and children are exempted from that 5-year wait, and also refugees, asylees, and permanent residents who were refugees or asylees. And I know that's a lot of information to kind of absorb, but all that is on that two-pager. Thank you.
No, thank you, Jasmine, for the interaction. And just making sure, remember, a person without legal status, they can apply for emergency Medicaid, but they are not going to be allowed to apply for Medicaid expansion or for the ACA. There is been a lot of misunderstanding with our communities who are just arriving to the country, because we've been aware about some fraud cases where people are receiving calls and they are trying to get a insurance. But if I don't have a social security number, or I don't have any category, immigration category, I will not be able to get an insurance in North Carolina. Please make sure that you identify those cases, because that is something that if they already sign in for an insurance without a legal status, that is something that they can revocate in some way, and then they will not have like any future issues. But just making sure those who are getting emergency Medicaid is because they don't have a legal status here and they having an emergency situation. Now, this question is very important with women who are pregnant, because actually, if they don't have qualified immigration status, getting a family plan, they will not be able to get the emergency service. Women sometimes they are enrolled in a family plan. I have a question for you guys. Do you know what is a family plan first? Raise your hand. Who can tell me what is a family plan? Tell me a little bit. Uh-huh. Yes? Are you awake? Or are you sleeping?
Hey, Francisco, I do not know it. Do you mind telling us?
Yes, let me tell you with the next slide. Carolina, next. Okay, I give you a bit. A family plan is those who are enrolled to try to talk about birth. If they want to apply for those services at the Department of Social Services, and of course, with the Department of Health, they are enrolled in a family plan for the birth control. If you are allowed to get family plan, and you already have a family plan, you may be contacted for Medicaid and saying, hey, you know what? You don't have to worry about anything about your Medicaid expansion application, because from family plan, we send you to the Medicaid expansion. Now, for the criteria eligibility, not a lot of people can be passing from family plan to Medicaid expansion, because maybe incomes have changed. But we have to make sure that if your family has a family plan, it already receive a letter saying that if they are enrolled to Medicaid expansion, or they are not enrolling anymore to Medicaid for the criteria procedures.
And just to add on this slide, Francisco, one of the common questions we get is, for folks who are aware of family planning coverage, and then folks who may not be eligible, there are still individuals who would qualify for emergency services such as labor and delivery, even if they don't qualify for Medicaid expansion or the family planning coverage. And I think that's what we're hoping to highlight, because oftentimes it may be during these emergency Medicaid situations that people can take advantage of it, or the first times folks have encountered the concept of Medicaid.
Yeah, that's why we totally encourage women who are pregnant when they arrive to a hospital for any service, just try to inform the hospital or the place that they are arriving that they are not have any legal status and they want to apply for emergency Medicaid. Now, we have a TPS, people who have a temporary protected status here in North Carolina. It's very common to hear that a lot of nationalities are getting TPS, but can people with TPS apply for Medicaid? The answer is no. People with TPS cannot apply for full health coverage through Medicaid. However, there is however, they may be eligible for emergency Medicaid as long as they meet the income and North Carolina state residency eligibility requirements. Pregnant women and children under 19 with TPS are eligible to apply for Medicaid if they meet all other eligibility requirements. It's been a huge misunderstanding for those nationalities who are arriving with TPS. Just remember, depends the category. It depends if you are gonna be eligible for Medicaid expansion. In this case, TPS is not applying for Medicaid expansion for full health coverage through Medicaid. But if you have TPS, you may check with Healthcare Marketplace, ACA. That is the one that is gonna help to get an insurance.
So additional